Good afternoon, the Media Center Ukraine Odesa continues its work. You can watch us online both on our YouTube channel and on our Facebook page, and you can also ask your questions online. Just scan the QR code that you can now see on the screen. Our current topic is Ukrainian Medical Center for Rehabilitation of Mother and Child of the Ministry of Health of Ukraine. Our speakers are Vladyslav Frolov, Medical Director of the Ukrainian Medical Center of Rehabilitation of Mother and Child, Iryna Burmus, pediatric neurologist, Klavdiya Slobodeniuk, expert on nursing development, and Viktor Hoydyk, professor, MD. Good afternoon, everyone. Thank you for joining us today at the Media Center Ukraine Odesa, and I would like to give floor to Vladyslav. Good afternoon, everyone. We would like to present the Ukrainian Medical Center for Rehabilitation of Mother and Child of the Ministry of Health of Ukraine. And there are two rehabilitation centers in the Kyiv Oblast and our Ukrainian Medical Center for Rehabilitation of Mother and Child of the Ministry of Ukraine. The vision of our institution is the rehabilitation of mothers and child at the national level during the war and after the war. The target of the audience of our patients, those suffering from the war, the families of veterans, of fallen heroes, internally displaced people, and those people who have been affected because of the armed aggression. We have signed several memorandums with different foundations, like the Children of Heroes Charitable Foundation. We have been closely cooperating with the foundation. We've had already get 5 families from the Zaporizhzhia Oblast, and we plan to have 22 more families. And we have provided services to more than 33 families that were displaced for oblasts with hostilities like Donetsk, Kharkiv, Sumy, Kherson, Mykolaiv, Zaporizhzhia regions. We also have people from Odesa, Chernihiv, Cherkasy, Lviv regions. As for patients from the city of Odesa can undergo outpatient rehabilitation. People from other regions can undergo inpatient rehabilitation that includes examination, accommodation, and all services are provided free of charge, and the course takes 14-21 days. The institution employs around 151 employees, including 103 persons that are medical professionals. So we have a powerful team of highly qualified specialists. The hospital is designed for 120 beds. We have 7 departments, like reception department, clinical diagnostic department of psychological and pedagogical correction, department of psychosomatic and neurological rehabilitation, department of psychosomatic and allergological rehabilitation, department of physiotherapy and physical therapy, and we also have our own laboratory. In 3 months of work, we have completed the renovation of mental health office and the women's health office, taking into account barrier-free access to premises. We are actively working on the implementation of the direction of mental health on the basis of our rehabilitation center, and our main goal is to restore a person both physically and mentally. Therefore, since the beginning of work, the center has implemented work with the population and communities, and we already have achieved results. Thus, in support of the All Ukrainian Mental Health Program, How Are You?, initiated by the First Lady Olena Zelenska, following the initiative of Daria Zakharieva, our director, a mobile multidisciplinary mental health team was created, including psychologists, psychiatrists, speech therapists, and if necessary, other specialized professionals can provide services. Since August 2022 of this year, our team has made 11 trips to the communities of Odesa region, and in total about 140 children aged to 18 have been already examined. In remote areas of our oblast lacks professionals. There is a large number of unexamined children in the communities. The number of children with disorders of the autistic spectrum have been identified. The practice of such trips and visits have shown that there is a large number of unexamined children. We also invite children to us. We prepare rehabilitation activities, and if we understand that additional examination should be conducted for a child, we can refer our patients and children to other healthcare institutions. I would also like to add that the mental health office has already been opened, where psychologists, psychotherapists, and psychiatrists provide their services, and everyone can refer to this office free of charge. One of our main goals is to help our doctors restore their physical and psychological condition so that they, in turn, can help more efficiently in terms of mental support to our patients. We have involved our international partners. They conducted training. For example, last week we had the latest training, and 20 of our employees has already completed the self-care plus training with quite a good results. Our doctors constantly undergo professional development in their specialty, but also in mental help for better communication with our patients. I would also like to give floor to pediatric neurologist Iryna Burmus to share more details about our activities. I'd like to add that in our center we accept children and their parents because we provide support and help to families. If they are neurological disorder, autistic disorders, or some other issues in children, they can be referred to us. These children can be examined not only in neurological area, but we can also check somatic health of children. They have their lung issues and some disorders in children. We develop individual rehabilitation program, which is developed by doctors like the doctors of rehabilitation healthcare. We also prepare individual rehabilitation program for mothers because it is very important for mothers and children to interact to achieve better results of rehabilitation. It is also important to note that children which are referred to us by their family doctors or by the doctor from our center or was referred to us by the multidisciplinary mental health team. Before being hospitalized, a child is examined not only in the targeted department, but other doctors from our center. I have recently communicated with a mother who arrived to us several weeks ago. There are disorders with speech in her child, sleep disorders, but during examination, it was found out that had problems with kidney, and this child cannot be fully rehabilitated in our center, and that's why the child was referred to urologist regional hospital, and I believe that after curing urolithiasis there, this child can come back to us. to make the rehabilitation program successful, we always identify targets. So this is a targeted program, and it is assessed after rehabilitation period is over. And we can also provide additional rehabilitation for further follow-up of children and parents. Sometimes repeated rehabilitation is needed for children and their families, and then their plan is developed for further follow-up of such patients. It is very important to note that our rehabilitation is evidence-based. We have a huge experience in developing rehabilitation programs and provision of rehabilitation support to children and their parents. And now we have widened our opportunities. We have received new equipment, and our children can have more detailed diagnosis. Because the victims of war, the IDPs, cannot receive help at the place of their residence, and we can provide such services and support to them, and this is great. It is very important to say that rehabilitation is based on mental support, support of psychologists, a speech therapist, a psychotherapist, mother, other relatives, or accompanying persons who also need mental support. They also can get support in mental health office. We also have other specialists, neurologists, children, pediatric neurologists, cardiologists, psychotherapists, gastroenterologists, and also ENT doctors, and that will improve the results of our rehabilitation programs. That's why we are always happy to support all the people who refer to us. Klavdiya, the floor is yours. As of today, the Ministry of Health of Ukraine focuses a lot on the development of nursing. And the Nursing Development Center of the Ministry of Health of Ukraine holds a series of educational events dedicated to current issues of the professional activity of nursing specialists. We actively participate in the mentioned educational events. On the 28th of August, it is planned to hold a conference, and our nurses will participate in this conference. There are 42 nurses in our team. 80% of them have a higher qualification category. This is a very important indicator that demonstrates high level of professionalism of our specialists. During the short period of time of activities of our new team, a lot has already been done to support, develop, and make independent the nursing profession, to honor the resilience and dedication of nurses in wartime conditions. The first thing that we have done, we were visited by the director of the Nursing Development Center of the Ministry of Health of Ukraine, Katerina Balabanova, and we met with the other representatives of the Ministry of Health of Ukraine, and as well as our nurses. That was an important visit for us, because during that visit we were able to discuss such issues as leadership, continuous professional development of our nurses, and our further cooperation with the Nursing Development Center of the Ministry. Then we launched the Self-Care Plus training, and 10 nurses have already been trained how to cope with the stress management, and they learned how to better care about their own health and to restore their internal balance. Because you see, rehab nurse is not just about care. This is 80% of rehabilitation. Nurse is 80% of successful rehabilitation. She knows the needs of the patient. She communicates with the patients and their families. A nurse is a guide at the same time, and nurses also need support because they are also humans. They can get tired, they can become anxious. That's why we have launched the series of trainings, for recovery of our nurses. And it is very important to ensure mental health care, a safe environment, and also it is very important to understand the psychology of danger in nursing. We also pay great attention to the teamwork of doctors and nurses, because in a team, a nurse is not only an assistant, this is a professional and doctor's partner, because nurses are responsible not only for proper patient care, but also they are responsible for psychological support to mothers and children that undergo rehabilitation in our center. Thank you, and now I would like to give floor to Viktor. I'd like to welcome everyone, and I would like to thank the whole team of the Media Center Ukraine Odesa for having this possibility to communicate with our audience. And now I would like to ask everyone to look a bit back and to look around yourselves. There is the war in our country. There are a lot of victims among civilians and in the military. Those fighters who are at the front line have their mothers, wives, who are here at the home front, and it is very stressful for the families of the military. This is a huge burden, and quite often they cannot deal with all the psychological issues by themselves. Nowadays, our team, and I will do this, perhaps say this for the first time, that we have developed the concept and the strategy of what we should do in the future. In Europe, in the United States, the first question, which is a person at rehabilitation, asked is about motivation. Do you want to relax? Do you want to recover your functionality? Do you want to be useful for the society and do what you like? That's why motivation is at the first place in our work. And then follows ideology. Ideology is very simple. This is ideology of the sun. The sun is the symbol of a family. If we are able to recover family, we can recover everything. And then in our work, we use these standards and achievements from all over the world. It is not a secret now. The information can be found, everything can be learned and applied. We apply best practices for treatment and rehabilitation of our patients, our young patients and their mothers and their families. I should note here that our center uses new technologies, new equipment. Deprivation apparatus. We used to apply them, but because the production has been destroyed, we get this equipment from abroad. We just follow all the new achievements of the science and technologies that can boost and improve the rehabilitation and recovery of our patients. If we take the first letters of our strategy and our mission, then we could make the word bridge, which is missed in Ukrainian. This means that we want to be a bridge between health, because healthy condition, to recovery, and to deal not only with physical but with mental issues. In the center, we have the sun. The sun is the symbol of family, and everyone now focuses on rehabilitation of fighters, but no one understands that the injured veterans come back to their families, and they face a lot of challenges, mental challenges, when it comes to understanding each other. The children are also under stress because they have not seen their parents for quite a long time. That's why we focus on rehabilitation of children, mothers, and fathers. And our main message, if we are able to recover families, will be able to recover everything. Thank you. And I have the question about equipment. It is modern equipment. What can be done with such equipment? Thank you very much for your question. You see, at the moment, we use evidence-based equipment and methods. So such issues as psychics or some other traditional medicines, they are not evidence-based. Some medication and some vitamins that we use are not evidence-based. I'm now talking about food supplements. We use the methods of electrostimulation, the methods of deprivation. We also use the sensor methods to improve and to expedite the rehabilitation. And we can now see results. We first examine our patients to find the problems. This is kind of a test and examination. After rehabilitation, the patient returns to us to undergo this testing again, and we can see the efficiency, the results. For example, a child with speech problems starts saying some words or making sounds, or a child after rehabilitation starts working. A child, for example, with psychosis, better response to the surrounding world. So we always monitor our results. We compare the results with the initial state. And then we teach mothers how to work with their child to improve the result. Thank you. Vladyslav, do you face any problems with the supply of medication because of the full-scale invasion? We do not face such problem at the moment. Donors from abroad support us a lot. So we don't see any problems with funds, and there are no problems with supply of medication. And as it has been mentioned by Viktor, we are transferring to evidence-based medicine and evidence-based medication that we need, and we don't use supplements anymore. You've noted that you've signed memorandum with the Children of Heroes Charitable Foundation. What is the target audience that you get through the center? How do you cooperate with them? The memorandum that we signed with them envisaged the common channel that we use for our cooperation. They refer to us our target patients, children and mothers, from such regions as Kherson, Mykolaiv, Zaporizhzhia. We also cooperate with other regions from Ukraine. So these children are referred to us, we examine them, we prepare a rehabilitation course, they undergo rehabilitation at our center, and we have the families in a queue for the repeated rehabilitation the next year. So we work like in circle. So we assess the initial state, we assess the results of first rehabilitation, we provide recommendations about how to improve the result at home, and then they come back to us. And this rehabilitation is free. Does it cover accommodation, food? Yes. So what is included? Accommodation, nutrition, examination, lab, and rehabilitation itself. Everything is free of charge. Are you looking for some additional professionals? We would like to focus on mental care. And we have sent our doctors for advanced training, but we are interested in psychotherapists, psychologists, speech therapists. So We have already contacted the knowledge base that will be able to train our doctors. I have a question to Iryna. Do you have a lot of children with PTSD? Quite a lot, because children suffer not only from explosions. And I would like to say that yesterday I had a mother and a child from Odesa district, and the child just started schooling this year, but the child is very afraid, and she sees the suffering around the child, and her father now defends our state, and there is a sleep disorder in this child. It is very difficult to fall asleep at 9. The child wakes up, cries, and this is the second stage of rehabilitation. They returned to us. We achieved results. During first rehabilitation, they want to repeat now. So we have a lot of children with PTSD, and neurologist response. We cannot diagnose PTSD into all children, but we hope that our services will be able to improve health of these children. How many children do you have now in your care? Up to 50 children who have such disorders at the moment. Yes. From what regions? We have children from different regions, from the city of Odesa, from the Odesa regions, from Sumy, Zaporizhia, Kharkiv, Mykolaiv, Kherson oblasts. So we get children from all over Ukraine. After rehabilitation in your center, do you provide some remote services? All mothers and children after rehabilitation receive instructions what they should do at home. And so this is what they learn from our psychologist or speech therapists. And so they do this, and if it is needed, then they contact their doctors to receive advice from them. So, and they also receive information where they should repeat rehabilitation to improve the result. Thank you very much for joining the Media Center Ukraine Odesa, and we will continue at 3 p.m.